Welcome in, everybody. Today we're doing a deep dive on cannabis.
Oh, yeah, this is going to be good.
It's a pretty hot topic, right?
Yeah, definitely.
There's a lot of talk about it. There's a lot of research coming out. There's the historical side of it, the health effects, and then just how it's used. So we're going to be digging into all of that.
Looking forward to it.
We've got some pretty cool research articles.
Oh, nice.
Historical accounts.
Okay.
And just, like I said, some updated data on everything.
Yeah, it's always changing, too.
Exactly. So we're going to try to just kind of separate fact from fiction here.
Sounds good.
Really give you a good understanding of the topic.
Yeah.
And I think one of the most interesting things that people might not know right off the bat is that cannabis wasn't always about getting high.
That's right. It has a long and varied history.
Right.
For centuries, cannabis was primarily known as hemp, which was, kind of a workhorse plant.
Okay.
And it was used for all sorts of practical purposes.
Practical purposes.
Like clothing, paper, rope, even food.
Really?
Oh, yeah. You can imagine the Vikings setting sail with their ships, their sails woven from hemp fiber.
Wow.
The ropes holding everything together, also hemp.
Interesting.
And these early varieties, they were low in THC.
Okay. Now, when you say THC, you're talking about...
Yeah, the psychoactive compound.
Yeah.
The one that gets you high.
Okay, so that's what we associate with marijuana today.
Exactly.
So if the Vikings were using hemp way back when did this whole getting high thing even enter the picture?
Well, that's a great question. And it all comes down to the discovery of THC.
Okay.
And realizing it had these psychoactive properties.
So that was like a turning point.
Yeah, you could say that.
Okay.
It really changed how people viewed cannabis.
So we went from this practical use to...
Yeah, more of a recreational or medicinal focus.
Okay.
But even with this discovery, hemp continued to be used industrially.
Makes sense. It's such a versatile plant.
It really is. Yeah. And, this distinction between hemp and marijuana, it's actually still relevant today.
Oh, really?
Legally, hemp is defined as cannabis with less than 0.3% THC.
Okay. So there's actually a legal definition.
Exactly.
And that plays into, the whole conversation about legality, which, let's be honest.
Yeah, to mess.
It's complicated. It's confusing.
Totally. On a federal level in the U.S., cannabis is still illegal.
Right.
But you have all these states doing their own thing.
Right.
Legalizing it for medicinal use, some even for recreational use.
So it's like a patchwork of laws across the country.
Yeah, you've got it.
Which makes things difficult to really even talk about,
Definitely adds another layer of complexity.
Exactly. And it kind of feeds into, all the debate surrounding the risks associated with cannabis.
Right.
Because it's often portrayed as being harmless.
Right.
But we know there are some valid concerns.
Oh, absolutely. And one of the big ones is the potential for addiction.
Okay, addiction. Now, I've heard this argument before that, marijuana is not addictive.
Yeah, that's a misconception.
So what's the reality?
Well, the reality is that about 1 in 10 adults who use cannabis will develop what's called a cannabis use disorder.
1 in 10, that's
significant.
That's a lot more than I would have thought.
And for those who start using before the age of 18, the risk is even higher.
Really?
About 1 in 6.
Wow. Okay, so it's age dependent too.
It seems to be.
That's pretty scary. And when you factor in, the rise of synthetic cannabis.
Yeah, that adds a whole other level of concern.
That's what I was going to say. What can you tell us about these synthetic cannabinoids?
So these are lab-created chemicals. They're designed to mimic the effects of THC.
Okay.
But the problem is they can be way more potent.
More potent than natural cannabis.
And unpredictable.
Yeah.
So they pose some serious health risks.
Serious how?
We're talking about potential overdoses, toxic reactions, even death.
That's terrifying.
And this is made even worse when these substances are laced with other drugs like fentanyl.
Oh, wow. So synthetic cannabis is definitely something to steer clear of. Just not worth the risk.
Not at all.
Okay. So we've talked about synthetic cannabis, but let's shift gears a bit.
Okay.
Let's talk about, natural marijuana.
Sure.
When we use it, what's actually happening in our brains and bodies?
So it depends a bit on how the cannabis is consumed.
All right.
When you smoke it, the THC is absorbed into the bloodstream really quickly.
Through the lungs.
Exactly. And it goes straight to the brain and other organs.
Okay.
Now, if you ingest cannabis, it's slower.
So it takes longer to feel the effects.
Yeah, it can take up to an hour.
Wow. Okay. So the delivery method matters.
Definitely.
Okay. But regardless of how we consume it, what are the actual effects? What's going on?
So THC interacts with specific receptors in our brains.
Okay.
And this influences a whole bunch of bodily functions. Well, you might experience altered sensory perceptions, changes in mood.
Okay.
You might have trouble thinking clearly.
Right.
Memory can be impaired.
So it's not just about feeling high.
No, it's a lot more complex than that.
Interesting.
And, at higher doses, some people might even experience hallucinations or delusions.
That's a little scary.
Yeah, it can be. And while these effects are often temporary,
Huh?
there's growing concern about the long-term consequences of regular cannabis use.
Long-term consequences, especially, for young people whose brains are still developing.
Exactly. That's a big concern.
What kind of long-term effects are we talking about?
Well, studies have suggested potential links to memory impairment, difficulties with learning,
Okay.
and even some mental health issues.
That's a lot to consider. It sounds like there's a lot more to cannabis than meets the eye.
Absolutely.
Yeah.
We need to go beyond those simple narratives
Right.
and really grapple with the complexity of this plant.
Yeah. And how it affects individuals and society as a whole.
Right. There's still many layers to uncover.
And we've only just scratched the surface here.
Yeah, we haven't even delved into things like medical marijuana
Right.
or how legalization is playing out in different states.
And what about the impact on pregnant women?
That's another important aspect.
There's just so much to discuss.
We'll definitely unpack all of that as we continue our deep dive.
Sounds good. I'm ready when you are.
All right, so let's get into medical marijuana.
Okay, yeah, let's talk about that.
You might be surprised to hear that cannabis-derived medications,
Yeah,
they've actually shown some promise in treating a variety of conditions.
that's right. I have heard about that.
Mm-hmm.
What are some of the specific medical applications where it's been effective?
Well, one of the most well-established uses is for managing nausea
Okay.
and stimulating appetite,
Right.
particularly for patients undergoing chemotherapy
Okay.
or those living with AIDS.
Right, yeah.
These medications can really make a difference for those individuals.
So it's more about alleviating side effects of other treatments
Exactly.
or the illness itself?
Yeah, improving quality of life.
Okay, that makes sense.
Mm-hmm.
But are there still concerns about using medical marijuana?
I mean, there are always ongoing discussions, right,
Right.
about the appropriate use, potential side effects, and the need for more research
Of course, yeah.
to really nail down all the therapeutic benefits.
Definitely. Seems like a field where we're still learning a lot.
Oh, absolutely.
Now, I know we briefly mentioned legalization earlier.
Right.
But I think it's worth exploring that a bit more.
Yeah, for sure.
What are some of the main arguments for and against legalization?
Well, it's a complex issue, right, with
Okay.
valid points on both sides.
Yeah.
Proponents of legalization often argue that it would allow for regulation
Okay.
and taxation of cannabis,
Okay.
potentially generating revenue for states
Right.
and reducing the burden on the criminal justice system.
Okay. I see. So kind of like a way to control it.
Exactly, and also potentially create jobs,
Oh, interesting.
boost the economy.
So there's an economic argument there.
Yeah, definitely.
Okay, but what about the other side? What concerns do opponents raise?
Well, opponents often worry about potential increases in cannabis use,
Okay, so like more people using it?
especially among young people,
Right.
and potential negative impacts on public health,
Such as?
like maybe an increase in impaired driving accidents.
Okay.
They also worry about the commercialization aspect.
Right.
Like, if it becomes more commercialized, you might see more aggressive marketing,
Yeah.
which could target vulnerable populations.
It's like any product, really.
Exactly.
It's a double-edged sword.
Yeah, it's a tough one.
It seems like both sides have valid points.
They do.
And it really requires, careful thought and an open discussion.
Absolutely.
Okay, now before we move on, I wanted to circle back to something we touched on briefly.
Okay.
The impact of cannabis use during pregnancy. This seems like an area where the risks are particularly concerning.
It's definitely an area where caution is needed.
Mm-hmm.
Using cannabis during pregnancy can have serious consequences
Yeah.
for both the mother and the developing baby.
Okay, like what kind of consequences?
Well, for instance, it's been linked to fetal growth restriction.
Fetal growth restriction, what does that mean?
It means the baby doesn't grow at a healthy rate in the womb.
Oh, so the baby might be born smaller than expected.
Exactly.
Okay.
And there's other concerns too.
Like what?
Studies have shown a connection between prenatal cannabis exposure and an increased risk of stillbirth.
Oh, wow, that's awful.
It is a very sad outcome.
Yeah.
Additionally, there's an elevated risk of preterm birth.
So the baby being born prematurely.
Yeah.
Wow, this is all sounding pretty serious.
It is, and it doesn't stop there.
Oh, no.
Babies exposed to cannabis in the womb are also more likely to have low birth weight.
So even if they survive and are born seemingly healthy.
Right, there can be long-term implications. There is growing evidence that prenatal cannabis exposure might be associated with long-term brain development issues.
Brain development, so that affects.
Things like cognitive function, attention, behavior.
As the child grows.
Exactly.
Wow, okay.
So the message is pretty clear.
It seems like it, yeah.
If you're pregnant or planning to become pregnant, it's best to avoid cannabis altogether.
I think that's good advice.
I agree.
Okay, so we've talked about the risks, but what about solutions?
Right.
For people who are struggling with cannabis use disorder, what options are out there?
Well, the good news is that there are effective treatment options.
Okay, good.
And while overcoming it can be challenging,
Right.
recovery is definitely possible.
That's encouraging to hear.
It is.
So what kind of treatments are we talking about?
Well, behavioral therapies have shown a lot of promise.
Okay.
One common approach is cognitive behavioral therapy.
CBT, yeah.
Exactly.
I've heard of that. That's where you identify and change negative thought patterns
Yep.
and behaviors.
Right, that's the basic idea.
Okay.
So in the context of cannabis use disorder, CBT helps individuals recognize their triggers,
Okay.
develop coping mechanisms for cravings,
Right.
and learn strategies to prevent relapse.
So it's about empowering people to break free from that cycle of addiction.
Precisely.
Okay, I like that.
Another effective approach is contingency management.
Contingency management.
Yeah, it uses positive reinforcement to encourage abstinence from cannabis.
So how does that work?
Basically, individuals receive rewards for staying drug-free.
Rewards?
Yeah, things like vouchers, prizes,
Oh, okay.
even cash incentives sometimes.
So it's like positive feedback for their progress?
Exactly.
Okay.
And then there's motivational enhancement therapy.
Okay, what's that?
It focuses on strengthening the individual's internal motivation to change.
So it's more about tapping into their own desire for a healthier life?
Yeah, and supporting their commitment to recovery.
That makes sense.
And of course, we can't forget about support groups.
Yeah, the community aspect.
Exactly, peer networks.
Right.
Those connections provide a sense of community
Right.
and shared understanding, which is so valuable.
Yeah, especially during recovery.
For sure.
It's great to hear that there are so many different approaches.
Yeah,
I think that really emphasizes that there's no one-size-fits-all solution.
absolutely.
What works for one person might not work for another.
Right. It's about finding the approach that resonates best with the individual.
And supports their unique journey.
Exactly.
Now, before we wrap up, let's look at the bigger picture.
Okay.
Do we have any data on just how prevalent cannabis use is in the U.S. today?
We do, and it's pretty significant.
I bet. I have a feeling the numbers are higher than we think,
You're probably right.
with all the conversation and the evolving legal landscape.
Yeah, so according to the latest data from the National Survey on Drug Use and Health,
Okay.
over 48 million Americans aged 12 or older reported using marijuana in the past year.
Wow, 48 million, that's a lot of people.
It is. It highlights the fact that cannabis use is widespread
It really does.
and something we need to be talking about openly and honestly.
Absolutely. And with that increased prevalence, it's even more important to promote informed decision-making.
Right, and that's where the knowledge comes in.
Exactly.
People need to understand both the potential benefits and the risks.
To make the best choices for themselves.
Exactly. Choices that align with their values and priorities.
Well said. I think we've covered a lot of ground here today.
We have.
From ancient hemp to medical marijuana, legalization debates, the latest usage data.
Yeah.
We've explored a lot of the different facets of cannabis.
It's been a fascinating journey,
It really has.
and I hope our listeners are feeling more informed,
Me too.
more empowered to engage in these conversations.
Absolutely, because it's a conversation that needs to be had.
It does.
So with all of this new knowledge, where do we go from here? What do you see as the future of cannabis?
That's the million-dollar question, isn't it? Yeah, it's a tough one to answer.
Right, it's hard to predict.
But one thing's for sure, the conversation's not going away.
It feels like it's just getting started.
Exactly. We're still learning so much.
And like you said, there's ongoing research, debates about legality.
All of that.
Social norms are changing too.
Absolutely. It's a dynamic topic.
Definitely keeps us on our toes.
It does.
Okay, so thinking about everything we've discussed about cannabis,
Right.
the ancient roots, the potential benefits.
Or risks, too.
Yes, the risks as well.
It's a balance.
It is. It's a complex issue.
It really is.
So knowing all this, how do you see the future of cannabis unfolding? What role should science, policy, and personal choice play in shaping it?
Well, that's the question, isn't it? It's something we each need to consider as we navigate this landscape.
Right, there's no easy answer.
No, not at all.
But science is going to continue playing a crucial role, I imagine.
Absolutely, it'd have to.
Uncovering the true potential, but also the risks.
Right, giving us a deeper understanding of how it affects us.
And we're constantly learning more as research progresses.
Oh, yeah.
But science alone can't dictate the future, can it?
No, it can't.
There's the policy aspect, too.
Definitely, policy decisions are crucial.
For determining how it's regulated, whether for medical or recreational use.
Exactly.
And we're seeing how different states are handling it in different ways.
It's like a big experiment.
Yeah, in a way.
And that policy debate's going to continue, I think.
As more data comes out, as public perception changes,
Right.
it's interesting to watch it all unfold.
It is.
But ultimately, it comes down to individuals, doesn't it?
Yeah, in the end, it's about personal choices.
Making informed decisions about cannabis.
Exactly.
Based on, what we know about the benefits and the risks.
Mm-hmm. Weighing those carefully.
And making choices that align with our own values, our own health goals.
That's the key.
Absolutely. And I think this deep dive has really shown us how important it is to approach this topic with, nuance.
I agree.
To think critically, to have open and honest conversation.
Because it's not about black and white answers.
Right. It's about understanding the complexities.
Exactly.
And, to kind of wrap things up, I love this analogy. Just like the Vikings relied on hemp for their sails, for their ropes, we can use our knowledge as a compass to navigate this whole evolving landscape of cannabis.
I like that. A compass.
So to our listeners, stay curious.
Yeah, keep learning.
Make informed choices.
It's a journey.
It is. And thank you for joining us on this deep dive.
Thanks for having me.
Until next time.